Our ethics and our structure of our experiences are really intertwined. So we emphasize local health systems and existing resources. We're not sending anyone from outside to create false structures or false narratives around who is solving problems, or who are the agents of change and elimination of health disparities. As such, we hold up local practitioners and community members as the experts of their own environment and position outsiders like you and me as learners and admirers. We utilize asset-based community development models as well as engagement approaches where you look at the strengths, capacities, and capabilities in traditionally resource-deprived settings that may look like they are lacking to outsiders who are from a different reality, but in reality are rich in innovation, ingenuity, resourcefulness, and commitment. And our programs are all based on fair trade. So we really ensure that when our scholars go in country, we are not further depleting resources and really recognizing all the work it takes to host you, me, and other global health scholars. If you want to learn more about our ethical best practices, check out our publications. We have really kind of put research behind all of the theory of change around how do we get toward more authentic global health engagement, less saviorism, less colonialism, less oversimplification of complex realities. We have competency-based education, so we're really intentional about how we develop as people and as professionals during our experience abroad or virtual experience. And you can see some of the competencies there. Our programs all have really wraparound pre-departure training that involves a course called Pillars of Global Health, which has competencies in global burden of disease, cross-cultural effectiveness and adaptability, health systems, and much more. Why should you engage with CFHI? There's many reasons, and Hema and the alumni that are joining us today are going to be able to speak to those in real time. But I will just say that there's a lot of opportunities, I think, to develop as humans and develop as global citizens and as global partners. So I hope you will join us. In terms of where our opportunities take place, we have both virtual and what we call place-based, which is where you actually travel in-country opportunities across the globe. You can see the locations there. There's a multitude of different themes that are highlighted by different programs and health systems. To learn more, visit our website or feel free to contact Mariah. Say hi, Mariah. Mariah is our program coordinator and advisor, so she can really help you tease out what programs are the best fit. At each site, we have a structured and formal leadership framework, which includes a local coordinator, preceptors, medical directors, as well as country coordinators to ensure that the experience is well supported. Here are as a sampling of our global team members. I know they all send their well wishes and are grateful for you taking time to delve into who we are and what India is all about. I'm just going to quickly overview a few concepts of the Indian healthcare system and then I'm going to turn it over to Hema. So India has what's called a pluriform health system, and I'm going to show you a graphic on that. You will hear in the discussions today really the emphasis on public health, so population health, where you go upstream of problems and try to prevent them. In settings that are extremely resource limited, public health is all the more important because treating problems once they arise is much more expensive and inefficient. There's also a tiered health system, and I'm going to show you a graphic of that. India has a very diverse geography and population, and there are internal health disparities that I'm sure Hema will touch on, but they have really been acknowledged for their huge achievements, both in addressing health disparities of minoritized groups, as well as achieving improved health status across the largest population in the world as of last year. They just surpassed China. Some of the achievements of the Indian healthcare system, it has been to improve life expectancy. India got its independence in 1947. At that time, the life expectancy was 32 years, and now it's anywhere between 70 and 71 years. Made huge gains in the reduction of infant and maternal mortality, has been polio-free since 2011, and has made reductions in malaria when the other top 11 countries couldn't do it. So India really serves as a role model for all of us, and I'm really excited to learn more about how we can adopt and adapt from their great work. I just did put an example here of kind of there's been many programs that have been launched in India that have been successful. One of our multitude of them are looking at perinatal care and these examples of programs using cash transfers to incentivize antenatal care, addressing and identifying high-risk pregnancies and ensuring institutional births. Just a few areas where India has excelled. Some of the themes you're going to see highlighted today fit into the framework of primary health care, which was really kind of defined in 1978-79 at Alma-Ata, which was a big conference in the USSR that resulted in the Health for All slogan, but also resulted in defining primary health care, which is different than primary care. Many of you go to a primary care doctor. This is different. This is really the intersectionality of clinical care and public health and health systems building. So these are the 8 components of primary health care, which include educating patient populations about epidemiologically significant health problems, promoting food security and nutrition, promoting adequate water and basic sanitation, and clean water supply, maternal child health, as you saw some of those example programs, which includes family planning, immunizations and prevention, such as what has been successful in terms of polio and other diseases, prevention of and control of locally endemic diseases. So endemic diseases are diseases that have a high incidence in a location that's kind of steady high over time, as opposed to a pandemic or epidemic where you have a spike. And appropriate treatment of common diseases and injuries, which may seem like a basic thing, but this is really talking about how the health system aligns around the burden of disease and what's actually affecting people. So really prioritizing things and being accountable to the health of populations, which is something that in the United States, we are challenged with. We do not prioritize diseases and population health in the same way India does. And so we can learn a lot. Also, provision of essential drugs. There's essential drugs program, essential pharmaceuticals that are defined by the World Health Organization and at a country and regional level. So really trying to be smart about using medications that are readily available, that are cost effective, and are not too expensive, and also have a secure supply chain. When we say pluriform healthcare providers, what we're talking about is health systems that straddle both public sector, private sector, for-profit, non-for-profit, formal and informal systems. This graphic is a little grainy, but it helps point out that there's a lot of levels that healthcare happens at, and I'm sure Hema will attest to this. There's a household level, community health center, and then hospital level, and there's gradations of hospitals that I'll show you on the next slide. Importantly, there's both formal and semi-formal and informal healthcare provision. And I would say one thing that India has also done really well is integrating alternative, meaning non-Western, non-biomedicine approaches into the formal sector. So Hema will discuss how the Ministry of Health is organized, but really recognizing practices like Ayurveda, yoga, naturopathy as formal entities and collaborating rather than ostracizing non-Western or non-biomedicine. This is another complicated graph about the Indian healthcare system, but just to say again, this pluriform system has the public sector that is structured by the government, and then the private sector that falls within both for-profit and non-for-profit categories. And India, some of their specialty hospitals are some of the best in the world. So really exciting work and innovation technologically. When you look at a referential or tiered healthcare system like India has, and is so important in resource-constrained environments, because you have to make sure that people are going to the closest and least costly healthcare provider for their problem. And so as patients get more complicated, they get referred to higher level hospitals, district hospitals, and ultimately the medical colleges and specialty hospitals. So that's a bit of a primer about the India healthcare system, and I'm super excited to introduce Hema Pandey, who's our country director in India. Thank you.
Thank you, Jessica. Good evening, everyone. I hope everyone is having a good week. And thank you so much for being here, for joining us today. So I would like to greet you in the Indian way, that is namaste, with your folded hands. And it means I bow to you. And Atithi Devo Bhava, which means the guest is the representative of God. So that is how we welcome people in India. Can we go to the next slide, please? So this is the Indian flag. It has three colors. It's a tricolor flag. Orange, the saffron represents strength and courage of India. White is for peace and truth. And in the middle, you see is the Dharam Chakra, which is also known as Ashok Chakra, with 24 spokes. And these are regarded as representation of progress, peace, and humanity's moral and spiritual advancement. The green signifies the fertility and growth. So yeah, can we move to the next slide, please? So about the demographics, most of the health indicators have been covered by Jessica, but I would like to tell you that India has, as Jessica said, India has surpassed China last year, and we are the world's most populated country now with about 1.42 billion people. India has only 2% of world's landmass, and we have about 20% of world's population. So when you visit India, you will see many people, and and that is the reason, because we have very little landmass and we are the most populated now. So our mostly population still lives in the rural area. That is 69 to 70% is rural, and only 30 to 31% is in the urban areas. Infant mortality rate, we have like with the recent data, it is now this is 25.5 deaths per 1,000 live births. And for the maternal mortality rate, the recent data shows it is 97 per 100,000 live births. So this is very, very recent. Like I just read the recent report maybe a few days ago, and now it has come to 97 per 100,000 live births. We were aiming to have 100 by 2021. So this is a good achievement for India. Prevalence of malnutrition, it varies across states in India. We have 29 states, and this disparity that you see between the two states, 55% and 27%, the basic reason is the education. So Kerala has the lowest 27%, and this is for the obvious reasons, because Kerala is the most literate state of India. And there were times when the literacy rate for Kerala was 99%. Now it is 90 something, not 99 really. So when we say literacy, we don't mean English. We mean that at least these people can read and write in their own language. And Madhya Pradesh is the biggest state area-wise also, but not very educated population. Literacy rate is 74%. Can we move forward, please? So it is important to understand and know that 70% of Indian health spending is on medicine cost and private outlays. So we pay mostly out of pocket for our medical expenses. We do have health insurances, but it only covers the hospitalization as such. It doesn't cover the outpatient, clinics or diagnostics or radiology tests when we talk about the spending. And also, I was going to say something, yeah, but it's okay. Yeah, so 70% of health spending is on this medicines and private outlays. Government spending is very, very marginal, very little. on the medical side, on the health side. And in the national policy of 2017, it was proposed to be increased to 2.5% by the year 2025 from 1.4% that was in 2016 and 17. So we are not spending as much, but still we are making a lot of, improvements in our health sector. Can we move to the next slide, please? So coming to and if anybody has any questions in between, please feel free to raise your hand, raise your virtual hand. We'll be able to see you. So coming to the culture of India, and Indian culture is beyond imagination if you have not been in India, because each state, we have 29 states, and I say each state is a country within a country. So it has amazing diversity throughout the country. Each state has their own, culture, own language, own cuisine, own, way of dressing. So everything is very diverse. And if we compare India's culture to any other culture in the world, I think India is very, very unique. Yeah, can we move to the next slide, please? So coming to the festivals of India, India has a lot of festivals. It is a land of festivals, and we say that we have festivals for every season, every religion, every region, every religious place. So when we say every season, there is a festival that will celebrate end of winter. There is a festival that will celebrate the springtime. So there are seasons for festivals for everything. And most of the festivals are, celebrated according to the lunar and solar calendars. So our dates and months may vary depending on these calendars. Excuse me. For example, Diwali falls around the same time of the year. Diwali is one of the India's biggest festival, and to understand, you can say it is Christmas of India. So, for example, Diwali falls generally starting anytime between the end of October to about, mid or third week of November, like that. So there is no fixed date. So every time we have to go back and check if we have to plan anything around festivals. Can we go to the next slide, please? So here are some glimpses of the festivals. So this is Holi, which is the festival of spring, and it signifies victory of good over evil. And I believe all the festivals, irrespective of the religion, signify, victory of good over evil. So here is the Holi celebration, which is the festival of colors. This generally falls in the month of March. Then Diwali, as I mentioned, is one of the biggest festivals of India. It's the festival of lights, and it symbolizes victory of light over darkness, good over evil. And again, when we talk about the diversity, this festival is celebrated across India, but different states connect this festival with different gods and goddesses. And we have hundreds and thousands of gods and goddesses in India that people believe in. So, for example, Northern India, it is mostly goddess Lakshmi, and then in other parts of India, it is, connected to different other gods and goddesses. And coming to more festivals, we have festival for brother and sister, that is Raksha Bandhan and Bhai Dooj. We have goddess of wisdom, that is where the learning is worshipped. This is called Saraswati Puja. This falls generally in the springtime. We have Karwa Chauth, where wives fast for their husbands' long life. And in the modern time, husbands also fast with the wives, which is very good progress. Not only wives just fasting for the husbands. My husband has always fasted with me, for past 23 years. So very blessed. Navratri, this is a 9-day festival that celebrates 9 forms of Durga. We have festivals for ancestors. We have harvest festivals, again celebrated across India, but with different names. And this celebrates end of winter. And not just Hindu festivals, all the other festivals are also celebrated in India with, equal enthusiasm, equal festivities are there. So Eid al-Fitr, Eid al-Adha, Halloween, Christmas, New Year's, everything is celebrated with full, excitement. Next slide, please. when we talk about the diversity, even the landscape of India, is not untouched when we talk about diversity. So we have very, very diverse landscape. We have, snow, we have desert, we have white water, we have backwaters, we have oceans, rivers, we have tea and coffee plantations, and we have Himalayas here in India and the other mountain ranges in the north, forests, lakes, plains that run parallel to Himalayas. We have the seventh largest desert of the world in India, Thar Desert. Then, lush green rainforest, forested mountains, coastal plains, wet, humid areas. So every state has their own feature. And some states are like, um one of these states actually is called the God's own city, God's own country, because of its beauty and the weather conditions, which is Kerala, where you see the houseboat in this picture. Um, can we go to the next slide, please? Food is very, very important part of Indian culture, Indian hospitality. Indians always express their love and concern by feeding people. If they are unable to feed people, they feel very, restless, like they could not feed the guests. So that is very important part of our culture. Very, so or most of the families have sit down meals with 2 to 3 main course dishes. And it's very unlike, like, we sit down on the table and have breakfast. We don't rush with a coffee mug in our hands and, go to work. So breakfast is a complete meal, then lunch, dinner, all the 3 meals are mostly sit down meals. And we have 2 to 3 main course dishes with pickles, chutneys, carbohydrate staples. Rice and roti are our main carbohydrates. Roti is the Indian bread, and desserts also. And it is just not food, we say, is not only important for eating, but a very, very important way of socializing, getting together with family and friends. So if we are visiting somebody's house, the first question is, what would you like to eat? So that is how, that is the importance of food in Indian culture. We use a lot of herbs and spices. And when we talk about herbs and spices, we also say that we have the medicines available in our kitchen. So most of these herbs and spices have medicinal qualities. We have large assortment of dishes. Again, cooking style varies from region to region. So you are having the same dal, that is lentils. If you have it in northern India, it would taste different. If you're having in southern India, it would have, maybe a coconut flavor or a tamarind flavor. If you are having it in western India, there may be some touch of sweetness in the same dal. So very, every state has their own way of cooking, the same thing. And now with the globalization, Indian palate has undergone a lot of change. If you visit here and you see the fast food centers, they would be serving chicken tikka burger, paneer pizza, all those Indianized versions of the Western food. Yeah, so yes. Again, coming to the attire of India, again, it is like very diverse in every state. Uh, Indian fashion industry has boomed a lot, especially, during the when the Bollywood industry started thriving in 80s and 90s. And our garments have a lot of influence from British and Islam because, of the British ruled India for 200 years, and we had Islam from the very beginning. India was invaded in the beginning. So we have a lot of influence, not just in the attire of India, but also in the vocabulary of India. Like when we speak Hindi, we don't realize how many Urdu or Arabic words we use in our day-to-day language, which we think are our own, and I always give the example of flower. So flower in Hindi, it's called pushp. But if you go and ask anyone on the street, they won't know. They will say phool. Phool is an Arabic word. So like that, we have so many other words that we use as our own because of, so much of influence from Islam and British. thank you and sorry are very, very popular here. So everybody knows thank you and sorry and please. Um, Coming back to the attire of India. So a lot of Indian emerging designers, they merge both old and Western elements and they perfect the clothes, fusion clothes, use art of embroidery on Western clothes and make statement garments. So you have to be here to experience all that. I cannot express in my words like what India is. You have to be really experiencing it firsthand. Can we go to the next slide, please? So here you see saris, so sari is a long 6-yard piece of cloth which is wrapped around. And this is the common traditional Indian attire for women. But here you see in these pictures, everybody is wearing a sari, all these women, but they are worn in a different style. So again, a lot of diversity. Every state has their own unique way of wearing a sari. Next slide, please. Then the other traditional dresses, salwar kameez and churidar that you see on the left, and the red dress that you see, lehenga choli. This is now become more of occasional wear. You cannot wear this in day-to-day life. So these have become more of like festival wear, or if you have a wedding in a family or any other function or any religious ceremony, then you wear dresses like these. So mostly now people are getting into comfort wear, which is salwar kameez or jeans or trousers. And similarly with the men, all these men that you see in these pictures, all these dresses they are wearing are mostly now occasional wear. And mostly you will see, not mostly, actually everybody you will see will be in, especially in Delhi or in other metro cities, men wear pants and jeans with shirts, t-shirts, because that has been accepted as a day-to-day wear. And all these dresses that you see, achkan, sherwani, bandgala, lungi, dhoti, pajama, all these have become mostly the occasional wear now. Coming to the marriages in India, celebrated with lots of decorations, music, dance, costumes, rituals. Again, depending on the community, region, religion of the bride and groom. Uh, they are like festivals in India, 4 to 5 days occasion, and mostly arranged marriages. What is depicted here in this slide is a northern India Hindu wedding. And you see a groom riding on a horse with the procession, and everybody dances in this procession while progressing towards the bride's house. In the next picture, you will see the bride entering the marriage wedding venue. Then exchange of garlands in the third picture that you see is a very important ceremony in Indian weddings, North Indian Hindu weddings. And then going around the fire 7 times with the 7 vows for husband and wife for each other. And then at the end, you will see the bride is leaving the parents' house, and you see she's throwing something behind. So she's throwing some grains, which signifies that she's leaving all the prosperity behind. She's not taking anything with her. So that is about the marriages. And dancing is the part of every celebration, whether it is marriage, birthday, anything. So any festival, dancing is, everybody dances, whether they don't know how to dance or not. So yeah. Coming to the public health program in India. So our program is divided into 4 themes as of now. So it is water and sanitation and social services NGOs, then safety net programs for marginalized populations, and palliative care program, which has become a big thing now in India, end of life care and home care. All that has become a very important part of Indian medical system. Can we move to the... So here are some national programs of India. That is Pulse Polio. As Jessica said, India has been declared polio-free by WHO. We have DOTS program, which is the short treatment for TB. So it's called Directly Observed Treatment Short Course. Basically, that's the full form. And DOTS program is delivered in every part of India through the district, like when we move forward, I think I'll tell you. And Jessica also mentioned we have district healthcare facilities, which is the who have the responsibility of making sure that all these facilities reach the common people. So DOTS program is very popular for TB, Janani Suraksha Yojana, which is the maternal health program, safe motherhood intervention, then target intervention programs, and Ministry of Ayush, which used to be a department, which is the alternate medicine system, which is Ayurveda, yoga, Unani, Siddha, homeopathy, and now some other traditional medicines have also been included in this program. And now it is a full-fledged ministry. And in India, both Indian system of medicine, alternative systems of medicine, and modern medicine, we all work together. All the hospitals, like the modern medicine hospitals, also have either the integrated medicine department or the department for Ayurveda, and people work together to treat the diseases or health issues. So very, very important part of Indian health system. Coming to the theme of the program, water and sanitation and social services NGOs. We have program with Sulabh International, that is the social service organization. And, we have Rural Hospital, which is based in heart of Delhi. We have Charitable Eye Hospital that we work with. And this is the picture from 2022. And you will meet Ganthar, who you see in this picture also, towards after I finish. So this is with Dr. Bindeshwar Pathak, who has a name in the social sector. We just lost him last year. He was about 85 years old, but very active till his last breath. He passed away on 15th of August. That was India's Independence Day. So he hoisted the flag in his office, and after that he felt had little restlessness. By the time he was taken to the hospital, he was not there with us. So yeah, but his legacy remains, and we are still working with Sulabh International, which is very important part of our program. And then we work with other non-profits as well. Talking about the safety net programs, we have programs with HI, like we work with a truck yard, which provides counseling and treatment to the truck drivers for HIV, and it is located in the middle of the truck yard actually. And similarly, we have Juvenile Rehabilitation Center working with the juvenile population, as the name suggests. Then we have Homeless Services NGOs. So there are students, in a session with the counselor and the technical person. We have programs for the marginalized populations. We work with Mitra Trust, that is the LGBTQ organization. We work with the Children's Center and slum areas. We work with migrant population, drug users, and cancer patients receiving palliative care. Then part of our program is, Hindi language classes. We provide cultural tours. We help students organize cultural tours to the nearby places when we are going for the program rotations, because Delhi is very vast and Delhi is full of history. So wherever we are going for the rotation, we advise students to, look at not just at the clinics and the healthcare settings, but also try to explore the surroundings and look into the history of Delhi and India. Students also visit Taj Mahal and other, monuments in India. We help them organize their weekend trips. We make sure that if there are any festivals there are any festival while students are here, we ensure that they are able to get the maximum out of it. They are able to enjoy the festivities. They are able to learn more about Indian culture. So yeah. So here are some glimpses of the pictures. Like here, we went for some festival lunch. So we have students with us there. Beatles Ashram is a very popular, sightseeing location for students where it is in Rishikesh, and Beatles created some of their beautiful music in this Beatles Ashram. Rajasthan, where you see the camels, Taj Mahal, and in the middle is the old Delhi, picture. So, yeah, that is all. And at the end, if anybody has questions, I'll be here to answer. Thank you.
Thanks, Hema. I'll turn it over to Mariah to chat about kind of how you can get involved and how you can experience all these things.
Yes, definitely. Thank you, Hema. That was an amazing presentation. It's always so fun and exciting to learn about Indian culture and all of the amazing innovations that the healthcare system is doing. So in terms of the actual CFHI program, what to expect, next steps, I see that a lot of you on the call are actually already enrolled in programs. So that's amazing. You might be currently working through some of these steps. But for anyone who's not, your next step would be to submit an application on our website, which is cfhi.org. It's a pretty easy process, and the applications are accepted on a rolling basis. So you'll just go ahead and create an account, submit an application for the India program, and then you'll fill out an application form with some basic information, as well as provide the name and email of a professional or academic reference. And as soon as those two steps are complete, we'll go ahead and review and accept your program application. This is usually within 2 to 3 business days. After that, you'll receive a welcome package that contains detailed information about deadlines, logistics, resources. You'll be invited to the health and safety orientation, which you'll attend 3 weeks before your program. You'll also be given access to a really robust pre-departure training, which Dr. Everett mentioned earlier, but you'll have access to a module that talks about logistics, as well as access to our course, Pillars of Global Health, which you'll also receive a certificate of completion for after you're finished with that. And then there's also some other resources in there just about helping you orient yourself to prepare for a global health experience. There's one about self-care and wellness, and there's also a module that will help you reflect on your global health journey. After that, you'll just want to fill out the application forms, and you'll actually be connected with an alumni advisor, which is a really great program we have implemented this year. Each of our program sites has an alumni advisor who will schedule a call with you a few weeks before you go, so you can ask them any of those nitty-gritty questions, and they can help you prepare. And then on top of all that, before you go, you'll also have live support from our team, as well as one-on-one advising, which you're welcome to set up with myself or anyone else from our team. Next slide, please. Okay, and then on site, just a little bit about what to expect logistically. Usually your start date is on a Saturday, which is going to be the day that you arrive at the airport in New Delhi. And someone from our amazing local team, either Hema or a local coordinator, will pick you up from the airport and take you to the lodging, which in New Delhi is an apartment. You'll receive an on-site orientation after you arrive, just orienting you to the culture in India, safety tips and suggestions, logistics of your program, schedule for your rotations, and the rest of your program. In the program, you can expect that you'll receive lodging, which is included in the program fee, as well as 2 meals per day. And also you will have about 6 to 8 hours a day of health-focused activities, which could include shadowing, health education outreach, learning about the NGOs that Hema introduced us to. And then also you will receive a weekly lecture and or reflection discussion section, just to kind of help you piece together everything that you're seeing in your rotations and be able to really get the most out of that. And of course, ask any questions that you have that will help you for your own comparison and knowledge and your experience for the program. And also you will have evenings and weekends free for leisure activities to explore the amazing and beautiful culture of India and do extracurricular activities.
Thank you, Mariah. That was super insightful. I really appreciate it. And I want to introduce Gunther, who is a CFHI alumni who went to India, who can just kind of give a little bit of insight on his experience. So yeah, feel free to take the floor, Gunther.
Hi everybody, my name is Gunther. Hi Emma, nice to see you again. I went to Delhi with CFHI in June of 2022, and I think I was one of the first groups to go back from reopening after COVID back in 2022, and so I spent 4 weeks in Delhi, and I would just probably echo everything that Dr. Ever just said about CFHI and their missions with their programs, and it was a really life-changing experience for me. And I think I learned so much just about the innovation that all of the groups we were shadowing with and learning from taught me on their really inspiring and amazing work that they were doing for the health of the Indian people. And I think that those are things that don't just stay in India, like those lessons learned don't just stay in India, they come with me on my journey right now. I'm currently in my first year of medical school at the University of Nebraska. And I think one thing that is kind of funny is just like, oh, Nebraska, like that's just a rural place. And it's, kind of true. But I think one thing that really kind of cemented how important this trip was to me was on my flight back. It was like India to Chicago and then from Chicago to Omaha, where I live. And the person I sat next to on that flight from Omaha to Chicago, she's actually from Nepal and was coming back from visiting her family in Nepal, and she spoke Hindi. So I was able to use the couple sentences of Hindi I learned in the program from our like night classes, basically with the Hindi, and she was so impressed and everything. And it really cemented the idea that the lessons I was learning was not just to stay in India, but is coming with me even to a place like Omaha, Nebraska. And I think those lessons will stick with me in this ever evolving global world where we have to be better global citizens. And that is sort of my takeaways from the experience. But I'd be happy to talk about any questions. I'm not sure if that was good or if I can answer any other specific things.
That's great. Thank you so much for sharing that. That is amazing. So if anyone has questions for an alumni, feel free to comment. And we're kind of just entering the Q&A session for the rest of the time. I did want to mention that we do have scholarships available, and I will post the link to our scholarship page in the chat. And if you have any questions about that, you can email me, and that is also listed on the scholarship webpage. So I'll post that now, and we'll leave it open for questions.
Sorry, and I was very vague. I guess like I didn't talk a lot about the specific organizations we learned from that Hema kind of touched on, but maybe I can talk about like my favorite one, which is this picture here with me and these two ladies. This was with the Can Support group on the right, where we spent 2 days doing the at-home sort of palliative care visits with this group. They Sister Raji is the one in the purple. I still remember them clearly. Sister Raji is the one in the purple, and she's a nurse. And she basically was. This group would go to cancer patients and their home, wherever they're living, whether it was like in a very rich sort of household or like fancy place, or in more like the slum areas. We went to all sorts of patients. They would check in on them. Sister Raji would do sort of an exam and talk about their medications. And then Jyotsna, who's in the more like black and white on my left, she was a psychologist, and she would talk with the patient and the family about more of the psychological things going on, or how they were doing as a family unit with caring for them. And it was just a really innovative way, I thought, to care for these patients and their families, and something that I don't honestly really see in America doing very much, is having both sort of from a medical standpoint as well as more of a holistic standpoint going into talk about how the patient and the family is doing. And it's something that I really loved, and I really kind of want to try to bring back with me. But that was just my favorite, I think. All the others were amazing too, but I guess that's all.
That's great. I did see a comment and someone asked the deadline for scholarships, and each scholarship posted has a different deadline. So if you click the link, it'll tell you the specific description, what countries it qualifies for, and then also the application deadline, and link you to the outside Google form that is the application.
And our summer programs have a May 15th application deadline for the actual program application. So check it out soon.
And I know earlier Mariah shared her email as well. So if you want to reach out to her or me, we can reach out to you if that's better, if you want to put your email in the chat.
Are there any questions for Hema, Gunther, or Mariah or Madeline?
I do have a question. Hi, my name is Miranda, and first off, Gunther, good story. I did enjoy listening to that. But I'm going to Delhi in July, and I'm from physical therapy, and I'm just wondering if any other students from physical therapy are going that you guys know of. Did you hear that?
Mariah, do you have any insights on that?
Yes, we heard all of our programs are multidisciplinary. So I'll let Mariah